Let me introduce myself. My name is Arini and Mellina. I'm from 383 Regular Class, Department of Nursing, Health Polytechnic of the Ministry of Health Semarang. I'm here because I will give you a presentation about Down syndrome. What is Down syndrome? Down syndrome is a genetic disorder caused when abnormal cell division results in an extra, full or partial copy of chromosome 21. This extra genetic material causes the developmental change and physical features of Down syndrome. And for your information, Down syndrome varies in severity among individuals, causing lifelong intellectual disability and developmental delays. And the signs and symptoms of Down syndrome. At birth, babies with Down syndrome usually have certain characteristic signs, including light facial features, small head and ear short neck, bulging tongue, eyes that slant upward, and atypically shaped ears, and then poor muscle tone. And mental and social developmental delays might mean that the child could have impulsive behavior, poor judgment, short attention span, and slow learning capabilities. Intellectual disabilities. Most children with Down syndrome have mild to moderate cognitive impairment. Language is delayed, and both short and long-term memory is affected. When to see a doctor, children with Down syndrome usually are diagnosed before or at birth. However, if you have any question regarding your pregnancy or your child growth and development, talk with your doctor. Causes. Human cells normally contain 23 pairs of chromosomes. One chromosome in each pair comes from your father, the other from your mother. Any one of three genetic variations can cause Down syndrome. There is trisomy 21, and then mosaic Down syndrome, and then translocation Down syndrome. For risk factors, some parents have a greater risk of having a baby with Down syndrome. Risk factors include advancing maternal age. A woman's chance of giving birth to a child with Down syndrome increases with age because older eggs have a greater risk of improper chromosome division. A woman's risk of conceiving a child with Down syndrome increases after 35 years of age. However, most children with the Down syndrome are born to women under age 35 because younger women have formed more babies. And being carriers of the genetic translocation for Down syndrome, both men and women can pass the genetic translocation for Down syndrome onto their children. And having had one child with Down syndrome, parents who have one child with Down syndrome and parents who have a translocation themselves are at an increased risk of having another child with Down syndrome. And Down syndrome treatments. There's no specific treatment for Down syndrome, but there is a wide range of physical and developmental therapies designed to help people with Down syndrome reach their full potential. The earlier you start them, the better. Each child will have different needs. Yours may benefit from physical, occupational, and speech therapy. And second, specialist education service. And then social and recreation activities. And then programs that offer job training and teach self-care skills. Is it Down syndrome curable or not? Here's no cure for Down syndrome, but there's a wide variety of support and educational programs that can help both people with the condition and their families. Data about disease worldwide or Indonesia. Certain parents have a greater chance of giving birth to a child with Down syndrome. According to the Centers for Disease and Prevention, mother age 35 and older are more likely to to have a baby with Down syndrome than younger mothers. The probability increases the older the mother is. Okay, thanks for your attention. If you have any question, please leave a comment. I will try my best to answer it. Thank you.